Today we're going to talk about Major Depressive Affective Disorder, also known as Major Depressive Disorder. Major Depressive Affective Disorder, or MDD, is a common and serious medical illness that, negatively affects how a person feels, thinks, and handles daily activities. It's really characterized by persistent feelings of sadness or a lack of interest or pleasure in most activities. The exact cause of MDD isn't fully understood, but it's believed to result from a combination of genetic, biological, environmental, and psychological factors. For example, genetics can play a role. Having a family history can increase the risk. Then there's brain chemistry, where imbalances in neurotransmitters like serotonin, norepinephrine, and dopamine may contribute. Life events like trauma, loss, stressful situations, or major changes can also be factors. Medical conditions, such as chronic illnesses, side effects from medications, or substance abuse, are important to consider. And finally, personality traits like low self-esteem or being overly self-critical might also play a part. MDD affects millions of people globally, making it one of the leading causes of disability worldwide. It can affect anyone, regardless of age, gender, or background, but it is, more common in women. Approximately 7% of adults in the United States experience at least one major depressive episode every year. So, let's talk about the signs and symptoms. For a diagnosis of major depressive disorder, symptoms must last at least 2 weeks and represent a change from previous functioning. Some of the most common symptoms include a persistent sad, anxious, or empty mood and a loss of interest or pleasure in hobbies and activities. You might also notice significant weight loss or gain, or changes in appetite, as well as insomnia or excessive sleeping. Fatigue or loss of energy is pretty common too. People may experience feelings of worthlessness or excessive guilt and have difficulty concentrating, making decisions, or just thinking clearly. There can be recurrent thoughts of death or suicide, or even suicide attempts. And sometimes there's psychomotor agitation or retardation, which means restlessness or slowed movements. When it comes to diagnosis, it's really a clinical process. It's based on a detailed patient history and symptom assessment. Clinicians use diagnostic criteria from the DSM-5, which stands for Diagnostic and Statistical Manual of Mental Disorders, 5th edition. It's important to rule out other medical or psychiatric conditions too. And sometimes screening questionnaires like the PHQ-9 or Patient Health Questionnaire are used as well. Management and treatment of major depressive disorder is, honestly, multifaceted and very individualized. It often includes psychotherapy, such as cognitive behavioral therapy, or CBT, interpersonal therapy, or IPT, and other counseling approaches. Medications are another key part, like antidepressants. These can include SSRIs, which are selective serotonin reuptake inhibitors, SNRIs, tricyclic antidepressants, or atypical antidepressants. Lifestyle changes also play a huge role. Regular exercise, a balanced diet, getting enough sleep, and avoiding alcohol or drugs can really help. Support systems, family, friends, support groups are important too. For severe or treatment-resistant cases, advanced treatments like electroconvulsive therapy, or ECT, and transcranial magnetic stimulation, or TMS, might be considered. And of course, regular follow-ups with healthcare providers are essential to assess progress and monitor for side effects. The prognosis for major depressive disorder can actually be quite good. Many people recover fully with proper treatment. Early diagnosis and sticking with the treatment plan really improve outcomes. Relapses can happen though, so long-term management may be necessary for some, but it's important to remember, untreated depression can lead to worsening symptoms and an increased risk of suicide.